Alright, let's dive into something that's both terrifying and deeply concerning, the Ebola outbreak in Congo. But before we get into the numbers, let me just say this. What's happening right now isn't just a health crisis, it's a stark reminder of how fragile our global systems can be when they're stretched to the limit. So, here's the deal. Congo has just hit a grim milestone, 2,000 deaths from Ebola, and this outbreak is the fastest growing on record. Personally, I think what makes this really interesting and alarming is the speed at which it's spreading. We're talking about a death toll that's tripled faster than the 2014 to 2016 outbreak, which was already the worst in history. That's not just a statistic, it's a red flag waving in our faces. Now, let's break this down. The outbreak was officially declared in May, but it actually started months earlier, in February. Here's where it gets even more concerning. It took about 9 weeks to reach the first 1,000 deaths, but only 3 weeks for that number to double. What this really suggests is that the virus is outpacing our ability to contain it. And if you take a step back and think about it, this isn't just a failure of healthcare, it's a failure of logistics, security, and community engagement. One thing that immediately stands out is the role of the Bundibugyo virus, which is responsible for this outbreak. Unlike the 2014 to 2016 strain, there's no approved vaccine or treatment for this one. Clinical trials have started, but they're happening in Ituri province, the epicenter of the outbreak, which is a remote and conflict-ridden area. From my perspective, this is a perfect storm of challenges. You've got rebel groups disrupting aid efforts, terrible infrastructure, and health workers going on strike because they're not getting paid. What many people don't realize is that these workers are literally risking their lives, and they're doing it without the basic support they need. Here's a detail I find fascinating. The case fatality rate for this outbreak is 45.9%, compared to 39.6% in 2014 to 2016. That might not seem like a huge difference, but it's significant because it shows that people aren't getting the care they need in time. Many cases are being reported late, or not at all. Dr. Jean-Marie Akandabo, who's on the ground in Ituri, said it best: no one is safe. And he's right. When you're dealing with a virus that spreads this quickly, every delay in response feels like a step backward. What makes this even more complicated is the region itself. Eastern Congo is a hotspot for conflict, trade, and displacement. People are constantly moving across borders, and that makes containment nearly impossible. Authorities have shut down public gatherings and the main airport in Ituri, but it's like trying to stop a flood with a bucket. The virus is ahead of us, as the WHO regional director put it, and that's a chilling thought. Now, let's talk about the bigger picture. This is Congo's 17th Ebola outbreak since the virus was first identified in 1976. That's not just bad luck, it's a systemic issue. The country is rich in resources but plagued by instability, and that creates the perfect conditions for diseases to thrive. Personally, I think this raises a deeper question. How many times do we have to see this happen before we invest in long-term solutions? It's not just about vaccines or treatments, it's about building resilient healthcare systems, improving infrastructure, and addressing the root causes of conflict. In my opinion, what's most frustrating about this situation is how preventable it could have been. Early cases were misdiagnosed as malaria or typhoid, and testing was delayed. That's a failure of surveillance, but it's also a failure of global attention. Ebola doesn't just affect one country, it's a threat to us all. And yet, here we are, watching the numbers climb while the world seems to look the other way. So, where do we go from here? Dr. Akandabo said it's time to double up response efforts, and I couldn't agree more. But it's going to take more than just throwing money at the problem. We need coordinated international action, community engagement, and a commitment to addressing the underlying issues that make outbreaks like this possible. As I wrap this up, I'm left with one thought. This isn't just Congo's problem, it's ours. And if we don't act now, we're not just failing the people of Congo, we're failing ourselves. So, what do you think? Is this a wake-up call we're finally ready to answer? Let me know in the comments below, and don't forget to like and share this video to keep the conversation going. Thanks for watching.